Today we are covering IV therapy and venous access, a topic guaranteed to show up on your NCLEX exam. The exam will test your ability to make safe clinical judgments, so let's focus on the most common scenarios. First, site selection for a peripheral IV. The NCLEX will give you a patient profile and ask for the best IV site. Always prioritize the non-dominant arm and choose the most distal site first. This preserves more proximal sites for future access. For example, if you have options for the hand and the forearm on the non-dominant arm, choose the hand first. The exam loves to trip you up with contraindications. Avoid placing an IV on an arm with a fistula, a history of mastectomy, or significant edema. If a patient has a left-sided mastectomy, you must use the right arm, period. That's a safety and critical thinking point. Next, let's talk about complications, specifically infiltration versus phlebitis. The exam will give you symptoms, and you must identify the problem and the correct first action. Infiltration is when non-vesicant fluid leaks into the surrounding tissue. The key signs are coolness to the touch, swelling, and taut skin. Phlebitis is inflammation of the vein, characterized by redness, warmth, and a palpable venous cord. A classic NCLEX question will describe a patient's IV site as cool, pale, and swollen. Your first action is always to stop the infusion and remove the catheter. For phlebitis, after stopping the infusion and removing the IV, you would then apply a warm, moist compress to reduce inflammation. Here's a simple way to remember the difference. Redness and heat, phlebitis can't be beat. Swelling and cool, infiltration's the rule. The NCLEX also tests central lines. You need to know the basic differences. A PICC line, or peripherally inserted central catheter, is inserted in the arm, but terminates in the superior vena cava. It's great for long-term antibiotics, but carries an infection risk. A tunneled catheter is surgically placed under the skin, making it more secure and less prone to infection than a PICC. An implanted port is completely under the skin and is accessed with a special non-coring needle. It has the lowest risk of infection and is best for intermittent, long-term therapy like chemotherapy. A question might ask which line is most appropriate for a patient needing daily antibiotic therapy for 6 weeks at home. A PICC line would be the most common and correct answer. Finally, you must be able to calculate IV fluid rates. A typical question provides the total volume to be infused, the time period, and the drop factor of the tubing. For example, a provider orders 1,000 milliliters of normal saline to infuse over 8 hours. The tubing has a drop factor of 15 drops per milliliter. The formula is volume in milliliters multiplied by the drop factor, divided by the time in minutes. So it's 1,000 milliliters times 15 drops per milliliter divided by 480 minutes. This gives you 31.25, which you would round to 31 drops per minute. Watch out for trick answers that use hours instead of minutes in the calculation. Always convert the infusion time to minutes before you do anything else. This single step prevents the most common error on these questions.